Assalamualaikum and hello, good afternoon everybody. Apa khabar semua? I hope that everybody is doing okay now, whether you are at home or at the office. We are now back on Facebook Live on Columbia Asia on Doctors Go Live. Okay, today we are going to be talking about thyroid, which is something that is not commonly heard of, but we all have thyroid. Okay, that much we know. Perhaps we know it regulates our metabolism, low metabolism and all that. But there is more that we need to know because it is very dangerous if we ignore the signs of a problem that you have with your thyroid. So we have with us today Dr. Rosliza Ghazali, our consultant general surgeon of Columbia Asia Hospital. Okay, hello Dr. Rosliza, how are you? Assalamualaikum.
Alhamdulillah, okay. How are you, Puan?
Good. We're all good today. It's very, very nice to have you with us today. So, the topic today we are going to be talking about thyroid, which is of course an area of your specialty. So, first and foremost, let's just ask a very basic question: where is the thyroid in our body, and what exactly is its role? What does it do?
Okay. As we know, thyroid is one of the organ in our body that we have little knowledge about it. Okay. So
Yeah.
basically, it is located in our neck. Okay.
Oh, okay.
Can
Here.
we show the slide? Okay. All
There
right.
you go. Okay.
As you
I
can
baru nak
see,
demonstrate tadi. Senang ada
huh?
slide. I
Yes.
baru nak demonstrate sini ke?
Exactly. Okay. So as you can see from the picture, the thyroid gland located in the neck, basically at the base of the neck, right? The butterfly shape, the red one. Ay, tapi
Okay.
tunjuk.
Which is right
Okay.
here.
Okay. Right here, the gland basically the butterfly shape, the red one from the image from the picture.
All right.
Okay.
All right.
All right. So
Mm.
basically, the function of the thyroid gland, as you
Mm-hmm.
mentioned earlier, basically
Yeah.
is control our metabolism. Okay, and at the same time is control the growth of the development of the human being. That's why
Oh.
it is one of the important organ,
Mm.
especially for newborn. Okay, that's why we screen thyroid disease is a part of the compulsory screening in a newborn. Okay, so
Right.
how it works, basically, the next slide, please. Okay, so basically, the thyroid gland is controlled by our brain. There's a specific center in our brain that
Mm.
gives signal to our thyroid gland to
Okay.
produce the hormone at the level that required by our body. Okay, so the name of the hormone basically we call it thyroxine. Okay, in a simple term, we use it T3 and T4. So in general, basically it regulate the metabolism, basically control of the heart rate, control everything that basically the system in our body. Okay.
Mm.
Mhm.
Doc, isn't it the brain that controls everything, or the brain gives instructions to the thyroid, and then the thyroid runs the show?
Yes. Now, what I'm trying to tell you, because a part of
Mm.
the brain, okay,
Mm.
they call it hypothalamus. They send a specific signal to the thyroid gland to produce the hormone. Okay.
Okay. All right.
Mhm.
So we're looking at the thyroid system now.
Yeah.
Okay. Would you like to
Can you
explain
see?
the thyroid system? Oh, I see. I thought you were going to explain about the thyroid system. Okay. No worries. So we
The
are
system, like I mentioned just now, that it's control the metabolism in our body. So basically, the whole system. Example, the heart rate, the brain function. So
mm,
whatever the function in our body actually controlled by the thyroid gland. Okay.
that's why
Later,
it's
I will
very
explain what happened if you lacking or
okay.
over
All right.
producing the islet. Okay. All right.
Yeah.
Uh,
Doctor, berkenaan dengan about the thyroid disease, there is a term goiter. I hope I'm pronouncing it right. Is it goiter?
Okay, basically, thyroid disease is a broad spectrum. Okay, it's a broad spectrum disease. When you mention goiter, is part of it. Okay, goiter
Okay.
basically just explain a swelling of the thyroid gland. That's why we call it goiter. So I have to make it clear what does it mean by thyroid disease. So as you know, it produces hormone. So the problem arises whether the gland produce more or produce less. Okay, when you produce more, meaning you are hyperactive, hyperthyroidism in the medical term. When you are producing less or not enough for our body, we call it hypothyroidism. Okay,
Mm.
and then apart from that, if you ignore all the, basically if no treatment given, you will develop goiter. Goiter meaning the swelling of the thyroid
Okay.
gland per se. All right, but sometimes you can also have swelling of the thyroid gland. It's not the whole gland, but the part of the gland. You call it nodule. So basically, the thyroid disease comprise of hormonal imbalance and also the swelling.
Okay, Dr. Farid. So today we are going to be addressing goiter, which is a disease to do with thyroid, correct?
Yes, yes,
Okay, but commonly when we talk about thyroid, a lot of people when they talk about weight loss and weight gain, they always talk about, oh, you have fast metabolism or you have very low metabolism and all that, and all this has got to do with thyroid, kan? So
yes.
just to clarify, uh, because I think generally people are interested in weight gain and weight loss, and why is it that when they eat a lot they don't put on weight, while some people they eat sikit and then they put on weight. So does this have anything to do with goiter, or it's just the way each of us are built? So thyroid for each person is memang macam tu, and but
Okay.
there's no danger involved.
I think I have to correct the terminology first. Like I
Okay.
said earlier, goiter is just the swelling of the thyroid gland. Okay,
Okay.
you we have those symptoms that you mentioned just now, whether you losing weight or you gaining weight, is
Mm,
related to the hormonal imbalance. Okay,
right.
in both condition, whether you are overproducing or underproducing, you still have goiter, regardless of the situation. So basically, when you're asking me about thyroid disease per se, first we talk about the hormonal imbalance. Okay, can we move to the next slide? Um, not this one, the one after that. Okay, so just now I mentioned about hypothyroidism, meaning you are you're not producing enough. Okay, basically
Mm,
you are uh, less of hormone in our body. So
okay.
basically the symptom is always opposite the hypothyroidism. Hypo meaning you are over produce the hormone. So whatever the symptom is a contradict between the two clinical condition, which is if you hyperthyroid, you basically losing weight despite you eat a lot, because remember the function is metabolism. So basically your metabolism rate is high. So when your rate is high, you're losing weight despite you eating a lot. So is it something good or not good? Okay,
It's
you might think
something
it's something good, but in long
exactly,
term,
exactly. Some people say,
uh,
wah, untungnya makan banyak tapi tak
untungnya,
gemuk-gemuk. Yeah,
okay,
okay.
but
Now
there's
we
a
want to know
danger.
lah.
Yes, okay. The
Mm.
danger if you actually long term, because just imagine your heart pumping more than usual. Okay, I'm
Mm.
giving you the scenario. When your heart pumping more, what will happen? You're at one stage, you're gonna have heart failure because you are
Oh.
over exercise, something like that. In
Mm.
short term, you nampak, wah, you actually lucky because you losing weight. Okay, but long term, all the organ in our body start to fail, rosak lah basically.
Oh, I see, I see.
Okay, but the symptom for you to know whether you got thyroid problem, of course, example that just now you said losing weight. Losing weight meaning makan banyak but you losing weight. And then the other symptom, you got palpitation. You are aware of your heart beating. Like now we are healthy human being. You don't actually, you're not aware that your heart actually pumping, right? So when
Right,
you got
right.
this thyroid problem, you are aware. You can sort of hear your heart pumping. Okay, we call it palpitation. Okay, you sweat a lot. Okay, and then you actually your bowel habit also jadi macam semua jadi overactive, meaning you akan dapat diarrhea. Okay, you become irritable. Okay, cepat marah. Okay, you cannot tolerate the heat. because badan you high metabolism, you panas. Then so because of that, in the heat environment, you cannot tahan. This is too much for you. Okay, so the opposite of hypothyroidism, meaning you are low, you are opposite, meaning you gain weight, you makan sikit you gain weight. Okay, lepas ni semua orang ingat makan sikit gemuk ni because of thyroid. Okay, but this is in general. Okay, and then you punya heart jadi slow, your thinking jadi slow. Okay, you dapat depression, you cepat letih. All those are the symptoms opposite of the hyperthyroidism.
Yeah.
Yang you hyper, you akan jadi rajin kerja lah. Yang hypo jadi malas. Okay. Okay, but appearance, okay, if you are high, as you can see from the picture, that one is a healthy one, okay, the normal. When you hyperthyroid, long term, not treated, you akan dapat changes. You can see from the eye, mata you pernah, I rasa kita pernah nampak kan, orang yang bulging eyes, you nampak macam, dia macam berkelip pun tak normal, dia tak boleh close the eye properly because the eyeball jadi macam besar. Then yes, then you nampak dia punya kulit pun kering. Then the obvious thing of course lah, thyroid swelling lah, you nampak bengkak of the neck lah.
Yeah.
Okay.
Okay, doctor, the symptoms that you said just now, how if you suspect that you have hypertension, is it? Sorry.
Hyperthyroid.
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 You see lah my eyes. I tengok slide, I cannot even see next to no.
I know. It's a bit okay.
Yeah, no, it's alright, no worries. So it's okay, hyperthyroid. One of the symptoms is mata yang besar, but this one, of course, if it's not like that regularly lah, I mean, while you are having this symptom, and then you will show all this when while you are having this what do you call it? This condition, I mean. When you are suffering through this condition, and then your eyes would bulge. Of course, you show the symptoms lah. But is this something? Is this something that can be regulated, the pace of the thyroid? Kalau maybe kita balancekan balik, ataupun kalau dia.
Of course, we're gonna talk about the treatment later. I think towards the end. So we have to understand about the disease first. Okay.
Right. Okay. All right. Okay, let's go to our next question first. So now we can address goiter lah. At least we know already about the hyperthyroidism, and how common is goiter among Malaysians?
Okay, actually, okay, next slide please. Okay, this is the statistic about in Malaysia. Basically, the prevalence of the disease is actually quite common, okay, especially in West Malaysia in comparison to East Malaysia. As you can see from the slide, yang Sabah Sarawak, okay, why, as you can see, this slide basically shows the level of iodine. Okay, there was study done in 2008, I think, from the 2008, isn't it, from the slide? Yeah. So basically, the iodine, why is it related to the goiter? Because it reflects the level of iodine in your blood. If you low in iodine, you tend to develop high goiter, because you tend to have hypothyroidism, and then you become hypothyroid and you develop goiter. So why is it iodine related to the goiter? Because to produce the hormone, you need iodine in our body. Okay, as you can see the slide next to it, okay, it's too small, the slide, okay. When we talk about the prevalence of the disease, basically is compatible worldwide, okay. As you can see, goiter about 9.3% in Malaysia. That one study done by Shahar et al. In 2017, okay. And then the prevalence of hyper is 3.4%. Hypo is 2.1%. And then somehow based on the ethnicity, as you can see, it is quite common among the Indian race.
Oh, why is that? Is there a reason for it?
Okay, the reason basically with the theory basically based on because of the iodine. Okay, why West Malaysia, why East Malaysia better? Okay, because East Malaysia, the salt that they use every day for cooking, the iodized salt. Okay, kalau kita perasan dekat kedai, kita pergi, you select ada certain garam saja yang ada iodized salt. Perasan tak? Tak perasan. Lepas ni kalau pergi shopping mall, boleh tengok the garam, it is related to iodine in the salt. Okay, other factor, because iodine contain in our food, in seafood, okay, dengan seaweed, so certain area macam rural area, macam pedalaman, dia punya source of seafood tu limited, so that's why orang asli, example, tend to have goiter more common than compared to the urban people.
Oh, so okay. Let's just take a look at the next question. So, this is goiter a symptom? Goiter is a symptom, doctor. That means you won't see it. There is no, it has to do with a thyroid disease, but it's not like it's a part of us. Do all of us have goiter?
Goiter, like I mentioned earlier, is a swelling of the thyroid gland. But sometimes when you have thyroid disease, not necessarily you have goiter.
Okay.
Okay. When whatever the problem, example, long term untreated, for example, hypothyroid, you end up having goiter as well. Okay.
Goiter is bengkak lah. It's the
Bengkak.
swelling of the thyroid lah.
Yes. Okay. But most of the people, they don't know. Most of the people, they don't know they got thyroid problem until they notice the neck become bengkak lah. Most of us, because they are not aware about the symptom like I mentioned earlier, macam losing weight, gaining weight, things like that.
Yeah, because they think that it might just be one of those things lah. Macam doktor kata they think that they are lucky, padahal there is an underlying problem. Okay, doctor, how can we tell if we have a thyroid problem? What are the telltale signs?
Sorry, repeat the question.
How can we tell if we have a thyroid problem?
How?
What are the telltale signs that we have a thyroid problem? Like macam doktor kata, mata,
okay, sorry. Okay,
eyes, anything else?
All right. Before you got all the sign meaning something that you can see. Actually, the symptom is, like I mentioned earlier, very generalized. I mean, that's why some, especially if it happen in pregnant lady, you are not aware that you got the thyroid problem because the symptom just fatigue, gaining weight. Sometimes it's very general. Okay, so other symptom, of course, yang we worry about is the neck swelling. Okay, that one is really obvious lah. Okay, the other symptom like eye sign, just now like the previous picture that I show you.
Okay. Doctor, is it possible to have a thyroid problem but you don't have swelling? That means you think, ataupun when it swells, when you have goiter, that means it's already teruk.
Okay, good question. Sometimes if you got swelling, most of the time people got swelling but no thyroid symptom. This is something that we have to be worried about because it may be a sign of thyroid cancer. Okay, all right. Those people basically they don't have hypo or hyper. This is a normal function of the thyroid gland, but they got swelling. So this is a sign of thyroid cancer.
I see.
Okay, so other symptom, like you said, if you asking me what other symptom, of course, when the swelling become bigger, increasing in size, you got this compressive symptom. Example, you when you swallow, you feel that difficulty in swallowing, ada macam lekat-lekat. Okay, when you breathe, you rasa susah, and then sometimes when you sleep, actually your partner will notice that you actually snore macam lah, the snoring. Okay, and then you tend to have cough, meaning irritative cough because of the thyroid gland already compress you punya your airways and your tempat makan, your esophagus. So that's why you tend to have that symptom. Another symptom, kalau you worry about cancer, you might have a change of voice, okay? Because the thyroid gland is very close to our suara. So when the the cancer actually dah merebak to the nerve yang control the peti suara, you will have change of voice. Example, we have this hoarseness of voice. It's
Okay.
already late sign. If you have that, it's already a late sign. Okay.
Oh, okay. What are the okay? At which point should you go to a doctor? Macam doktor kata, the symptoms are very general, that you gain weight and whatnot. So you may
Hmm.
not think that you are that it is.
If you think, okay, if you think your metabolism is not right, in the sense that normally you bukan pemarah, example suddenly you become very irritable, sikit-sikit nak marah. It's something that your close friend or your partner say, why you change? Meaning there's change of attitude or behavior. Okay,
I
that's
see.
then yeah. Another thing, notice that you cannot heat intolerant or cold intolerance, whatever the extreme temperature. You normally orang lain like duduk comfortably, but for you it was panas. Something is not
Oh,
normal. Then it's something
okay.
that you should be alert, aware about. Okay.
Okay. Okay,
Okay.
just look for signs like that lah.
But then when you got swelling in the neck, regardless, you got symptom hyper or hypo, that one is a must to see a doctor.
Okay. Among the two, which is more serious, doctor? Which is more dangerous? Ataupun, is it the same?
Both are dangerous.
Both are
No
dangerous.
different. Yeah, yeah. The other
Both are dangerous in what sense? What is the worst that can happen with either or? Can both result in cancer?
because like I said, if you hyper, you basically, example just now, heart failure. Okay, if you're hypo, okay, you all the organ function also slowing down. So this is not good for our body. Like it's not a normal function. Okay, but not just that. What I mentioned just now about the thyroid swelling is because even though you don't have hormonal imbalance, you're not hypo, you're not hyper. Yeah, but the thyroid swelling itself is a sign of cancer. So that's why it is important for you to be aware of the neck swelling, basically.
Okay. Doctor, just now we mentioned about the stats. Can we took a look at the race. I mean, it's more prevalent among certain races, and then also the age group.
Mm,
But talking about the thyroid developing,
mm.
is it more because of genetics, ke, through infection, ke, or habits? What?
Okay, basically you, because like thyroid disease is a broad spectrum. If you're talking about hormonal imbalance per se, of course this is related to our diet. So that's why I mentioned about iodine earlier. Okay, this
Okay.
iodine level. Okay, that's why it's more common in West Malaysia, but not in East Malaysia, Sabah, Sarawak, because their salt actually contain iodine in a cooking salt, everyday salt. That's why the prevalence of the disease is lesser compared to West Malaysia, Semenanjung lah. Okay,
Yeah.
alright. So when you talk about family history, just now you mentioned, is more of the thyroid cancer. Okay, when you talk about thyroid cancer,
Okay.
basically the risk factor, basically long standing goiter, kalau not treated, the risk of cancer is there also. Okay, okay. Of course, family history play a role. Okay,
Yes.
if you got family who has thyroid cancer, so you
Mm.
are at risk, higher risk compared to the normal population. Okay, if
Okay.
you got this exposure to the radiation during
Yeah.
childhood time, okay, also at risk of developing cancer.
Okay.
Mm.
And then to counter that, for example, when you're mentioning about how people in Sabah and Sarawak, the cases are not that vast among them
Uh,
because they is iodine.
mm.
What are the ways that we can care for our thyroid? Because in terms of salt, kita pun ada iodine salt, so maybe
Mm.
we can
Ah,
change our diet or our way of preparation of our food. What can
yes. So basically is basically which is about diet lah. Okay. Of course the easiest way, basically, because we do have easy to get to buy iodized salt. That would be the easiest and I said the cheapest code. Of course, when it comes
correct?
to the income to food, of course seafood, seaweed is expensive lah. But those diet actually the food that contain high iodine. Apart from that, like vegetable, dairy product like milk, yogurt, cheese also contain high level of iodine.
Oh, I see. I see. Yeah.
Mm.
Yeah, I thought I think the common perception is that seafood ada iodine, but I didn't know that even vegetables and dairy products ada juga iodine.
Not selected vegetable, not all. Don't get me wrong. Okay? But
I
certain vegetable also not good for whoever. Example, people who like to eat soya product. Okay, macam tempe, any kind of soya food.
mm,
It will interfere with the iodine uptake in our body. So because of that, it become, even though you eat a lot of iodine, okay,
mm,
I mean from the food, and
yeah,
then yet you see you eat a lot of soya product as well, it will
yeah.
bring down the iodine because it will interfere with the regulation of the iodine uptake in our body. So another vegetable, cabbage, broccoli, cauliflower, also will
Yeah.
bring down the iodine level in our body.
That sounds very tricky actually, doctor, because
See,
there's also a common perception because soybean is supposed to be healthy, there's a lot of protein there.
mm,
For people who don't know, as they consume soybean, but they also have thyroid problem, then it would be counter effective lah.
I don't think it's going to be a problem for healthy people. I'm talking the
Ah,
specific is for people who already got problem. Example,
I
people have
see.
got on treatment and then yet you eat all those food and make it worse. That's what I mean. Okay.
Okay, okay, I see. Are there any other ways for us to care for our thyroid apart from food? Maybe certain supplements ke? Is there anything to do with exercises and whatnot?
Not really, I think. No, no, I don't
Okay,
think so.
okay. So it's more pemakanan lah, more food intake lah. Okay, what happens if we ignore our thyroid problems? We already see the symptoms, but we still don't think that it's anything serious, so we just leave it.
Okay, okay. The scenario will be different. Example, if you ignore your hyperthyroid symptom, eventually you will get this osteoporosis because tulang you semua akan jadi osteoporosis lah, the
Yeah.
thinning of the bone. Okay. Um, of course, the other effect yang lain-lain yang I mentioned earlier lah,
Yeah.
which
Yeah.
kegagalan organ-organ di dalam badan kita. Uh, Kalau for hypothyroid, you like your brain function dah slowing down. Okay, for quite some time. Eventually, you will get Alzheimer, dementia.
Oh, I see.
Hmm.
At a young age.
The
Oh,
long term, because this thing takkan jadi lah masa few years, the more than
yeah.
10 years, you ignore the symptom, eventually you develop those lah. That will be the end result.
Yeah. Maybe you can mention again the age group at which thyroid problems happen.
Okay,
The
most common around 40s lah, 40s. 40 years
40s.
old and above. But for thyroid cancer, not really. It's got two spectrum, in young age and also adult. Meaning young age with thyroid swelling is something that you lagi should be aware of because it's related to genetic and family history. Young age really teenagers and
Yeah.
also more than 50. So they got two spectrum of disease for thyroid cancer per se lah.
Okay. Okay. So, goiter is one of the symptoms yang doktor kata that shows that we do have a thyroid problem. When we have thyroid cancer, are the symptoms the same as well?
The thyroid cancer, basically the symptom is the swelling.
Is the swelling?
Swelling of the neck, yeah.
Okay. Okay. All right. So we have spoken about thyroid cancer. Would like to ask about who are the ones at risk of developing thyroid cancer? Apart from the stats that just now we also mentioned, you mentioned about it being hereditary, 40 and above, and also even younger. So those
Tadi,
you can
okay, tadi
this
I rasa cuba slide tak tahu slide nombor berapa. Thyroid cancer slide. Not that one before. Yeah, thyroid cancer slide. Okay, you can see from the picture, right? The risk for thyroid cancer per se, we mentioned that tadi banyak kali kan, it's a family history,
yes.
having history of breast cancer, being a woman, somehow, I don't know, you don't ask me why, but it's more common in women compared to men for thyroid cancer. Yeah, okay. And then also, of course, history of radiation exposure, especially during childhood. Okay. So
How do sorry,
radiation exposure, example CT scan during masa kecil, Uh, that would be the risk factor for developing thyroid cancer.
Okay, okay. Alright. So I was afraid that it might be something to do with, like using your phone often, or going to the microwave.
Uh,
Um, all these
I
like
think that
harmful
everything
radiation.
is possible. When we talk about the gadget and nowadays, I think everything is
Ah,
possible because, but there is no study to confirm
yeah,
that. But there is a lot of theory behind that. That's for sure.
yeah, that's right. Okay. Okay, we've spoken about who are at risk for developing cancer, and then we would like to take a look at, okay, doctor, about treatments. Yeah, now, sorry, doctor.
How
What are the treatment options?
Okay, before we go to the treatment option, I think we should know how to diagnose the disease because when you got the
Oh,
symptom I mentioned earlier, we should know
yeah.
how do we confirm that. Okay, it is very simple actually. The blood test, a simple blood test, as by doing just one blood test, you can know whether you got this a hormonal imbalance, whether you are overproductive or you underproductive. Okay.
Okay.
All right.
Okay.
The other way, when you got swelling of the neck, okay, because sometimes swelling of the neck doesn't mean you got thyroid problem, okay. Sometimes just a simple gland of the neck that becomes swollen. So the other test to confirm whether you got thyroid swelling or not is really the ultrasound of the thyroid.
I see. And
Ultrasound.
what would be the treatment for that?
Okay, sorry, I haven't finished yet about the how to make a diagnosis. Okay, sorry. Okay, as you can see from the picture, if you got the swelling, then it's confirmed by the ultrasound that you got thyroid swelling. To confirm further whether it's something cancerous or not cancerous, meaning yang bahaya atau tak bahaya, further test would be fine needle aspiration, meaning you just like a blood taking, but actually you poke the area, you macam blood taking lah, you aspirate the gland, then you send for the assessment lah. You get the cell from the thyroid gland to confirm because not majority of the thyroid swelling actually is not cancerous, it just bengkak saja. Okay, if it's cancerous, then meaning it's something that kena act upon faster lah.
Doctor, now
Okay.
I understand that there are certain things like screening, thyroid
Mhm.
screening. So what
Mm.
happens during thyroid screening? What is it? What does it involve, and what is it for? How detailed of a condition can you find out through doing screening?
Maybe we are not aware because the thyroid hormone is important for the development, especially during for newborn. That's why we do screening for all the babies without we realizing it. We do thyroid screening for all the babies in this country. So that will be the screening for general population, all okay. But we don't do routinely for adult. Okay, but if we do have that symptom, definitely blood test would be enough to confirm whether you got this hypo or hyperthyroidism. Okay, but for the thyroid swelling is different issue lah. We that one you need to do another test, which is ultrasound scan of the neck and also the fine needle aspiration, like I mentioned earlier.
I see. Okay. So maybe we can move on now and talk about the treatment available to address
Okay.
thyroid.
Okay. For the treatment, it depends on what will be the problem because as you can see, the disease is a very broad spectrum. Okay.
Yeah.
So if you are hyperactive, basically if you are hormonal imbalance, the treatment basically is to control the hormone. So we just treat with medical therapy, treatment, medication, ubat lah. Okay. Example, if you are hyperthyroid, example, we got carbimazole to bring down the hormonal level, and then the doctor will adjust accordingly based on the level. When we do the regular blood taking, then we adjust basically medical therapy. Same goes to if you are hypothyroid, meaning you are lack of the hormone, you just give supplement of the hormone. Actually you eat thyroxine. uh, okay, but for the treatment of the swelling, goiter, or when you become so big, the treatment is surgery. Okay. Well, before you decide whether surgery or not surgery, you have to differentiate whether it's cancer or not cancer. If it's cancer, meaning you have to do the surgery regardless the size. Okay. if you still remember the shape of the thyroid is like a butterfly. So if only one part of the gland is involved, you can just remove partially, meaning sebelah saja, lagi sebelah boleh tinggal. So but it can work like normal. You don't need dua belah thyroid to function for to regulate the metabolism of our body and all the function of our body. So if the swelling is not cancerous, bukan cancer, but still got swelling, the treatment basically surgery if indicated, meaning you dah start rasa choking, susah bernafas, susah makan, that's the point where you actually do the surgery. So to relieve the compression. Okay.
After surgery, what are the effects after surgery when you remove the problematic area tu? Can you talk, you eat macam normal tu macam mana? Because of the location kan, so I imagine that there will be
Yes.
after.
Semua orang akan takut. All my patient pun akan takut bila I mention
Oh,
about
dekat
thyroid.
TV.
Because the thyroid gland located at very area yang agak sensitive lah with a lot of blood vessel and then near the peti suara, voice box. Okay. Bila surgery, the risk nombor satu yang orang paling takut actually the voice lah. Okay.
Yeah.
You akan kalau dia very close to the nerve yang control the voice, you akan dapat hoarseness of voice. If you are a singer, maybe you tak ada high pitch lah, you tak boleh menyanyi high pitch, okay. Tapi kalau anak-anak suka kot, dah tak boleh marah anak lah. You tak boleh high pitch lagi. But the risk I mentioned, all the thyroid surgery you're gonna have it, meaning the risk is there, but most of the time shouldn't be a problem lah. Okay.
I see. Makan? Any problem with eating?
No. Shouldn't
Actually,
kacau. The reason you most of the patient operate because dia start kacau you makan. Because when the swelling become makin besar, you susah nak makan. So that's the reason, indication for you to do surgery lah.
I see. So when you remove the thyroid problem too, then you will be able to sleep better as well, because you mentioned earlier that it can also interrupt your sleep.
Your airway, yes, true. Because actually your trachea just behind there, right? So when it become besar, compress you punya, then dia akan susah bernafas lah.
I see.
Your symptoms, definitely.
Right. Okay. So before we open the floor to questions from the viewers, I just like to let the viewers know that currently Columbia Asia Hospital Klang, they have a screening promotion for thyroid going on. So of course we will post this promotion on our Facebook page. So just look out for it. Then you'll be able to know more details. So bolehlah nanti Dr. Rosliza, if anybody wants to go and say hi to you to talk about thyroid problems, this would be a good time.
Boleh, anytime.
Okay, let's see if we have any questions. Okay, we've got a lot of people buat thumbs up dekat you, doctor, dengan hi, Barjish Paul, macam-macam Afish. Ramai peminat lah, doktor. Big Barjish. Okay, let's see.
Nak tanya, macam nak ada a few question I nak jawab macam mana?
Yes, there is a question by Siti Akila Syed. What are the available treatments? Maybe ada any that you would like to add on?
Saya dah mention kan. So first we have to know dulu what type of thyroid disease that you have. So the treatment is according to the thyroid disease lah, yang macam I mentioned tadi.
Yeah, okay, all right. From Fit, who always gets thyroid problems? Who always can get thyroid problems?
Okay, when we talk about hormonal imbalance, who are at risk, basically who are taking less iodine. So who are they? So basically from the statistic I showed earlier, we are at risk in this region, okay? Because our cooking salt doesn't contain especially, but somehow I think we eat a lot of seafood every day, right? Alright, so people who are living in the rural area, orang asli kat kampung lah yang tak ada access to the seafood, they are at risk. Yeah.
I see. Yeah, if anything, maybe we should just all change to iodine salt lah, if it is possible, kan? And if we can. Okay, and then who? Okay, from Mr. Afiq also, is thyroid same as lymphoma?
Siapa Mr. Afiq ni? Okay.
What does that mean?
Okay, intelligent question. Okay, so basically thyroid lymphoma is one of the type of thyroid cancer. Okay, and the treatment is different. We treat as lymphoma. Bukan lymphoma boleh jadi kat mana-mana je. Okay, so thyroid also boleh dapat lymphoma, but the treatment is
Lymphoma
not
apa
strict.
doktor?
It's
Lymphoma is blood cancer.
cancer darah. Yes, you are right.
Okay,
Because thyroid tissue also contain lymph node, so you boleh dapat thyroid lymphoma dekat thyroid gland, but the treatment is not surgery. It's more of chemotherapy. It's different.
I
It's
see.
a but it's type of thyroid cancer as well.
Okay. Okay, Puan Hidayah Sama is asking, can we fully recover from thyroid after treatment?
Very broad jawapan dia. Of course, kalau just hormonal imbalance is very simple. We just medication, yes, it is. You can fully recover. For the cancer, it depends on the stage.
Yes.
Okay, but if you asking me, among all the cancer in the world, kalau lah you kena pilih lah to have cancer, thyroid cancer is the best because it's not the best in the sense that cancer it sounds scary, but because it's not aggressive as compared to other type of cancer.
Oh, that means it takes a long time for it to develop ataupun because dia
Exactly. Dia tak senang spread. Dia susah nak spread. Meaning kalau you dapat cancer pun you lambat, very slow growing, and then most of the time most of the patient recovered fully from the thyroid. I forgot to mention about the treatment. Yeah, so I'm so sorry. Some of the disease, kalau dia fail medical therapy, tadi I mention medical therapy, right? Hypothyroidism, for example, if you fail, meaning I tak boleh control dengan medical treatment, there are other option. You can have radio iodine ablation therapy. Okay, so basically, some sort of radioactive treatment. Okay, radioactive. Then you actually shine to the thyroid gland to make it less active. Okay, and it's also a treatment for thyroid cancer, meaning after the surgery, for further treatment, you don't need chemo, but you have this iodine to kill all the small cell yang masih tinggal lah lepas surgeon dah buang, kadang-kadang masih ada small thyroid tissue, then radioactive the treatment as well.
Okay, let's move on to the next question. Ms. Siti Akila Shahid is asking, does thyroid dysfunction have anything to do with diet?
Definitely. Like I mentioned, it's related to our iodine intake. So those who doesn't like seafood and then taking a lot of soya base, and also the salt doesn't contain iodine, also at risk for developing goiter.
Okay, all right. Mrs. Lily Chong is asking, which is more common, hyperthyroidism or hypothyroidism?
I think I already given the statistic earlier. Hyper is more common, it's about 3.4%, hyper about 2.1%. Hyper is more common.
I see, okay, all right. Oh, there's one from Lorraine Yit as well. Can sea salt intake trigger thyroid?
I don't think so, because thyroid, okay, if you are asking me about the salt per se, if you take too much of iodine, okay, maybe you are thinking might lead you to hyperthyroidism. Okay, it's not easy because how do I say? Taking too much iodine is not something that banyak sangat lah. I don't think our body say if you eat a lot of iodine, you will end up with hyperthyroid. Theoretically, you can, but in reality, I don't think so lah.
Okay. All right. Miss Rachel Ko is asking, will inflammation around the thyroid affect the thyroid and cause hyper or hypo?
Inflammation meaning radang, is it? Okay, there is other condition, okay, which I didn't mention in detail. Certain disease, when you got this thyroiditis ataupun inflammation of the thyroid because of the viral, the doctor basically tak tahulah, tapi when you got neck pain and you notice your thyroid bengkak, we call it a condition of thyroiditis, that will start in hyper and then later hypo, then become normalized. So the treatment basically just to address it's temporary, it's not permanent. Okay?
Yeah.
Okay. And another scenario, sometimes our body, we call it autoimmune disease. It's something that you cannot control.
Yes.
You tend to have this hyperthyroid as well. Okay, then we call it grave disease. Then your thyroid gland become active. That one we have to confirm with specific study which at the antibody level in our blood. It's the more specific. Okay.
I see. I see. Okay. I have a question by Miss Ain Fariza. What is the most food intake that can trigger thyroid? I think she means what kind of food that can trigger thyroid.
Hmm. Okay. Soalan ni susah sikit saya nak faham. Semua orang ada thyroid. Adakah maksudnya, okay, macam tadi I dah bagi example, right? Food that with kacau, you put the thyroid hormone, example, uh,
Soya lah.
kan, I mean, yeah, soya, cabbage, broccoli, they interfere with the iodine in uptake in our body. So definitely dia akan kacau lah. Okay, but
Yeah.
that one spesifik cakap orang already got hypothyroid problem on treatment and dia makan benda-benda macam ni, then susah nak control lah. That's what I mean lah. Of course, food intake yang we encourage to eat to avoid the disease, yes. Makan seafood, makan seaweed that will prevent you from having hypothyroidism that will lead to goiter.
Okay. Mr. Afid is also asking, how do we know if we have thyroid or
I think
lymphoma?
kita dah jawab tadi kan. Oh,
Yeah, I think just now you asked whether it is the same
okay.
thing.
So basically,
But it's
because
just how do we know?
okay, basically it's thyroid cancer. It's one of the thyroid cancer. So basically, what if you know? You only know if you got swelling of the neck, bengkak lah.
Okay. Okay. As opposed to lymphoma, taklah adalah lain-lain symptoms agaknya kan?
Lymphoma, you tahu you ada bengkak. Dan that's why I said whoever yang ada bengkak dekat neck, please see the doctor because you don't know whether it's something yang dangerous or something yang you boleh ignore. So the doctor will do further test lah, not just a simple blood taking, not enough.
Yeah, yeah. Okay. All right, we've got one last question from Miss Cecilia Chong. How old or when should I get thyroid screening?
I mentioned already, all babies in this country already have thyroid screening done. It's a compulsory, it's a must. All.
But in adulthood,
Sorry? Adult?
when we have thyroid screening when we are babies, and then after that, doesn't mean that we are all safe.
After that, it's not a routine screening, only you got symptom.
Okay, okay. So at any age lah, that means when you have symptoms at any age, you can just go for thyroid screening.
Yes, definitely. Because as far as we know, I mean, because that's part of the policy, that's why we screen already. Everybody in this country, I tak ingat tahun berapa lah, the government actually started the screening program for the newborn for the thyroid problem.
Oh, I see. Okay. Okay, we're going to take one last question by Mr. Afid. Rajin ni Mr. Afid ni tanya soalan bagus. Who have okay, whoever has thyroid cancer, can they breastfeed babies?
Bukan thyroid cancer ni. Okay.
Sorry, thyroid. They have thyroid, can they breastfeed babies?
Because a certain medication, okay, it's not suitable. If you got say a hormone, maybe Mr. Afiq cakap pasal orang yang ada hormonal imbalance lah. Okay, certain medication, if you are taking medication, if you are even pregnant, that medication tak sesuai because it will harm the baby. Okay, so you have to change the medication because you still need to take the medication regardless whether you are pregnant or you're not pregnant. So same when you are actually breastfeeding. You have because there are few types of thyroid medication. So you have to, for example, people are on long medication and they are try to get pregnant. Doctor normally change the type of tablet medication.
So that means even if you have a thyroid problem, you can still conceive. You can still get pregnant.
You can conceive, but it's not easy. That's why whoever got thyroid problem need a special care from the obstetrician.
Complex lah kan.
Yeah.
Okay, well, all right. It seems like that is all the time that we have for today. Thank you very much, Dr. Rosliza Ghazali from Columbia Hospital, Klang. We hope to see you again, inshallah. Maybe we can talk about other problems to do with either thyroid or anything else. There's just so much for us to know. Okay,
Okay.
thank you everybody for joining us on Doctors Go Live. We will see you again next week. Thank you.
Bye.